Good afternoon. My name is Alan Bostic from Glenville, North Carolina. I came to see Dr. Spiegel on June the 1st of this year, 2006, after being diagnosed with RSD back in June of 2001. Since then, I've been through many different pain clinics, therapies, seen different neurologists, seen all kinds of pain specialists, been through physical therapy. Nothing has ever worked. Nothing's ever been consistent. I've had spinal blocks. I've had specific nerve blocks. I've even had the
morphine pump response stimulator?
I've had the morphine pump, but I've had the sympathetic nerve blocks. And while the sympathetic nerve blocks were successful to a point, they only lasted for hours, at the most a day. I never have been able to get any kind of relief. I did have the pain pump installed in March of 2004. It was originally filled with baclofen to help with the spasmodic reaction. Then a combination of baclofen and morphine was introduced, and while it's been a constant drip since then, there's been some relief, but there's never been any relief from the total overall pain. I've had swelling, the edema, the burning and shooting pains, everything from my both hips, both knees, both calves and feet and ankles. Particularly my left foot and leg was affected. I've had plenty of problems with my lower back, which is where surgery was done, and that's what precipitated the RSD. After coming, and I came here being hopefully skeptical, I've been amazed at what can be done and what kind of reaction I've had. Within the first week, the initial swelling was down by at least half and stayed down. I've had abnormal sleep patterns ever since this began. And while I'm not on a normal schedule now, at least when I sleep well. I do get some good rest, which I haven't been able to do for the last 4 years. The swelling still continues to go up and down, but it's more localized to the areas that are affected, and the same way with the pain. The pain's been reduced. I've never had any day I would call less than a 7 on the pain scale. And during these treatments, I've been down to where I've had days that I was at a 3, which is a complete freedom for me. It's almost like being in no pain at all. When you've had that constant pain for so long and you get that kind of relief, you feel like you can do anything, and you try to do everything, but being careful, you have to cut back on what you desire to do, what you want to do, and continue with the treatment. One of the things that has impressed me the most about coming to Dr. Spiegel and his staff is that this is the most cohesive, caring bunch of people that you could imagine. In no instance have I ever run across a group of people, a unit that worked so well together, covered everybody, made sure that the patient was number one. Patient was always the first priority. Everyone covered for everyone. The lead technician in the hyperbaric chamber had emergency appendectomy surgery, and the lead nurse took over his responsibilities while he was out and not able to do his job. With never a glitch, never a hitch in what was best for the patient. And even during that time, while the lead technician was out, the staff was accommodating and did everything they could to make the patient, me, and all of the other patients that we see more comfortable. We've grown together like almost like a family unit, and it's sad to leave them. We're glad to be going home, but there's a little sadness in leaving what we consider to be friends behind. Overall, I'm impressed and I'm excited. I'm going home with a new attitude, the ability, I think, to go into physical therapy and be successful with it where that's never been possible before. I also know that if I do have a relapse or a reoccurrence, that I'm welcome to come back and be seen again and taken care of again until I get to the point where everything evens out and I am able to do the things that I want to do. So my thanks to Dr. Spiegel and his staff, and I'm pleased to be able to report a success over the last 6 weeks that I haven't seen in over 4 years.